we can all agree that the RHS exam is all about x-rays, right? Wrong. There's radiation physics, patient safety, equipment, infection control. Yes, infection control wrapped all into one test. This is the DANB. It is never that simple. What good, DA besties? It's your girl, Leela. Who else? And welcome back to
the DAStudySpot, yeah.
Today, I'm giving y'all 10 must-know questions for the RHS DANB exam. Let's go on ahead and get started, but before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it!
Question 1. What is the ALARA principle and why does it matter? The answer, ALARA stands for as low as reasonably achievable. It means dental professionals should always minimize radiation exposure to patients and staff without compromising diagnostic quality. Exam tip. ALARA is the foundation of everything on the RHS exam. If you're ever unsure about a radiation safety question, ask yourself which answer best reduces exposure. That's almost always the ALARA answer. Question 2. What is the difference between ionizing and non-ionizing radiation? The answer, ionizing radiation has enough energy to remove electrons from atoms and can damage living tissue. X-rays are ionizing. Non-ionizing radiation does not have enough energy to ionize atoms. Examples include visible light and radio waves. Exam tip. The RHS exam will ask you to identify types of radiation. X-rays, gamma rays, and cosmic rays are all ionizing. Remember, ionizing is the type used in dental radiography, the type we take precautions against. Question 3. What is the purpose of a lead apron and thyroid collar during dental x-rays? The answer? The lead apron protects the patient's vital organs from scatter radiation. The thyroid collar specifically shields the thyroid gland, which is highly sensitive to radiation. Exam tip. The thyroid collar is the detail the exam loves to test. It should be used on all patients, children, adults, and especially pregnant patients. The thyroid is one of the most radiosensitive organs in the body. Question 4. What is the purpose of collimation in dental radiography? The answer, collimation restricts the size and shape of the X-ray beam to reduce the amount of radiation the patient is exposed to. A rectangular collimator provides more protection than a round one. Exam tip. The DANB will test you on the difference between rectangular and round collimation. Rectangular collimation is preferred because it significantly reduces patient exposure. It limits the beam to only the size of the film or sensor. If the answer choices include rectangular collimation as an option for reducing dose, that's almost always correct. Question 5. What does the term radiosensitive mean and which tissues are most radiosensitive? The answer, radiosensitive tissues are the most easily damaged by radiation. The most radiosensitive tissues include bone marrow, reproductive cells, the thyroid gland, and the lens of the eye. Exam tip. A helpful way to remember radiosensitive tissues. They are rapidly dividing cells. The exam may ask you to rank tissues by radiosensitivity. Bone marrow and reproductive cells are always at the top of the list. Question 6. What is the difference between the bisecting angle technique and the paralleling technique? The answer, the paralleling technique positions the film or sensor parallel to the tooth and uses a longer cone. It produces more accurate images with less distortion. The bisecting angle technique bisects the angle between the tooth and the film. It can cause image distortion but is sometimes used when anatomy makes paralleling difficult. Exam tip. The RHS exam favors the paralleling technique as the preferred method because it produces less geometric distortion and more accurate representation of tooth length. Know why one is preferred over the other, not just the names. Question 7. What causes a cone cut on a dental radiograph? The answer, a cone cut happens when the PID, the position indicating device, is not aimed correctly, causing part of the film or sensor to not be exposed. The result is a clear, unexposed area on the image. Exam tip. Cone cuts are caused by incorrect horizontal or vertical angulation of the PID. The fix is always repositioning the cone. The exam may show you an image and ask you to identify the error. A white or clear area at the edge equals cone cut. Question 8. What is foreshortening and what causes it? The answer, foreshortening is when the image of the tooth appears shorter than the actual tooth. It is caused by excessive vertical angulation, meaning the X-ray beam is angled too steeply. Exam tip, foreshortening equals too much vertical angulation. elongation equals too little vertical angulation. The exam will test both. A quick memory trick. Foreshortening equals for real, it's too steep. Elongation equals not enough angle so the image stretches out. Question 9. How should dental x-ray equipment and supplies be managed for infection control? The answer: the x-ray tube head, cone, and controls are considered non-critical surfaces and should be covered with surface barriers that are changed between patients. Digital sensors are semi-critical and must be barrier protected and then heat sterilized or high-level disinfected between patients. Exam tip: digital sensors are a favorite RHS exam question because they're semi-critical but heat sensitive. The protocol is barrier during use plus sterilization or high-level disinfect after. Don't let the heat sensitivity confuse you. Barriers don't replace proper disinfection. Last question, number 10. What does a film or sensor that appears too dark on a radiograph indicate? The answer: an overexposed or overdeveloped image. Causes include too high a KVP or MA setting, exposure time too long, or in film processing, developer temperature too high or developing time too long. Exam tip: dark image equals too much exposure or too much development. Light image equals too little. The RHS exam will give you an image description and ask you to identify the error and the fix. Always trace the problem back to its cause. Technique error versus processing error.
Oh, hey, you're back. Those are your 10 must-know questions for the RHS exam. If any of those tripped you up, that's exactly why you're here. Save this video so you can come back to it before exam day for a refresher. And if you want to be certain to pass your exam on the first try, the very first try, go ahead and click that link in my description box and grab your ultimate certification study guide today. This is a comprehensive study guide, 6 modules, 375 plus questions with answers and rationales, tables, time management strategy, tooth numbering system, emergency protocols, OSHA compliance checklist, score interpretation guide, the list goes on. Don't miss out on an opportunity to study smarter. Hit that link in my description box. If this video was helpful, subscribe, like, save, share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.